The Bexar County Sheriff's Office making changes now that a fourth inmate has committed suicide in the last month. 40-year-old inmate Melvin McKinney hanged himself despite changes to lights and other things in the cells to try to prevent that. The sheriff today told us she has increased checks and added supervisory personnel. McKinney was in jail charged with shooting a San Antonio police officer following a standoff in 2013. It's estimated 1 out of 5 inmates at the Bexar County Jail has a mental illness, and the reality is more than half of those mentally ill will end up back in jail. But as our Aaron Nichols explains, there's a bold new program aiming to break that cycle.
At the top of the highest point on the east side is the Summit, a convent built in the 1920s by the Sisters of the Holy Spirit. Flash forward about 100 years, it's now owned and operated by Crosspoint Incorporated, a nonprofit working to help former inmates reintegrate into society.
This gives them a leg up.
Kevin Downey is the executive director. A few months ago, a light bulb turned on. Apply that same philosophy to help the mentally ill.
If you put them in jail and they don't get the service they need, or they don't have the connecting services when they leave jail, the fact is they're probably going back to jail.
Next month, construction on the new diversion wing will begin.
Bedrooms? You have to use your imagination.
It's a partnership between Crosspoint and the Bexar County Jail to help reduce recidivism among the mentally ill who have committed nonviolent crimes.
So we're going to have 35 men and women living on this floor.
In addition to housing, the wing will also provide counseling, job training, and medical services.
We will ensure that there's the accountability they need so that they aren't wandering around. They'll be drug tested, alcohol tested every time they come back to the facility.
Bexar County Sheriff Susan Pomerleau says those in need would be identified before they ever step foot in the jail.
If we had identified that individual first, the first time they committed a crime, and gotten them into the kind of treatment that would help them be productive and focus on wellness, think about how many people we could have saved.
It costs about $50 a day to house an inmate at the jail, but it could cost anywhere between $60 and $250 to house a mentally ill inmate. Crosspoint says they can do it for less than $100 a day.
And that's with mental health professionals, with case managers, with residential monitors on staff, having the facility staffed 24/7.
Crosspoint is funded through federal contracts and private donations. But because they can only house 35 people at a time, Downey says the goal is to inspire other nonprofits to follow in their footsteps.
Part of this is getting people to admit that there's a need for it, but also getting citizens to buy into this. It makes our community safer and stronger because the person is leading a productive life where they are relatively happy, and we don't have to worry about them cycling back into jail or prison.
Aaron Nichols, News 4, San Antonio.